the chief guest, Dr. Pratap C. Reddy, to deliver the convocation address to the candidates.
Your Excellency, the Governor of Tamil Nadu and Chancellor of the Tamil Nadu M.G.R. Medical University, Dr. Rose Garu, Honorable Minister for Health, Government of Tamil Nadu and Pro-Chancellor of the Tamil Nadu M.G.R. Medical University, Dr. Vijay, Dr. S. Kumaresan, Professor Emeritus, National Academy of Medical Sciences, Dr. Malvanan Natarajan, Vice Chairman of the Tamil Nadu Medical University, dignitaries, Namaste. It's indeed a great pleasure and privilege that Dr. M.G.R. Medical University has given me an opportunity to deliver the 23rd Convocation address on this day. Your Excellency, Dr. Rose Garu, has been a well-wisher to me personally and to Apollo for the past 3 decades and has supported our emergence as a global healthcare player. We are indeed grateful to you, sir. I am very pleased today that Pro-Chancellor of the Dr. M.G.R. Medical University is holding a very important portfolio in the Honorable Minister for Health at a crucial point in time. We just heard in just 1 year what this government could do in the field of health and health education. We congratulate you, sir, and we say we are all with you in your efforts to transforming health of the state. It's a privilege, Dr. Kameswaran, the senior most ENT surgeon and illustrious surgeon, is with us as the chief of, as a guest of honor today. Professor Malvanan's father, Professor M. Natarajan's contributions in the rapid advance of the orthopedic specialty are immense in India and across the world. He was renowned as an outstanding orthopedic surgeon, an illustrious speaker, and more importantly, he had a great impact on the lives of his students and society at large. His contributions in formulating health policies were also noteworthy. Dr. Malvanan, with an illustrious background, you have grown to a stature that your parents would be proud of, and the country accepts your singular contribution to health. Today, as the Vice Chancellor of the M.G.R. Medical University, you have brought laurels and given leadership a new focus in developing energetic health leaderships. Please accept my commendation on behalf of all of us from what you have done in the year and years to come. I take this opportunity to congratulate the recipients of the Lifetime Achievement Awards. I have personally known their significant contribution to health and health education. Congratulations and our deep appreciation. It's a great pride to see the budding young generation of healthcare professionals receive their degrees. Now, with the excellent program that you have gone through under the Tamil Nadu M.G.R. Medical University, you will be an asset to the nation and help serve 1 billion people. It would be only right if I say that each one of you will singularly impact our nation's health landscape. I hope the entire nation will focus the lead of the Tamil Nadu M.G.R. Medical University in expanding the number of undergrads, graduates, and postgraduates to cover the entire spectrum of healthcare. From a seemingly inconspicuous industry, healthcare is becoming increasingly dynamic and significant industry today. So you will need to practice to meet today's healthcare requirements. A decade ago, the Indian healthcare sector was not considered as a key driver of national economic performance. However, over the years, there has been a fundamental change to this paradigm, with conclusive evidence from the world over, firmly establishing that improved healthcare leads to better economic performance and prosperity. The direct benefits of healthcare have become too large to be ignored, and Apollo has started its vision when I lost a young man who was only just 38 years. He was to go to US for his cardiac bypass surgery, Unfortunately, he could not raise $50,000 to go to US. When I lost and saw his wife, who was only 31-year-old, with a 4-year-old daughter and a 2-year-old son, I said, how many more are going to lose their dear ones for not being able to raise $50,000? This tragic incident catalyzed a revolution and was the genesis of Apollo. Today, almost all the departments are able to match with the best institutions anywhere in the world. In cardiac surgery, we are proud to say, under Gidnath's leadership, we have done 125,000 cardiac surgeries with an outstanding success rate. What makes us feel so proud is not only the cardiac excellence, to be able to say that an Indian need no longer to pay $50,000, but we're able to give the same or better outcomes with $3,000 to $5,000. Similarly, many other Indian hospitals today have adopted the best technologies and are able to tackle complete clinical problems to take on the newer burden of disease. You would have heard just now our health minister emphasizing that WHO declared that India probably is polio-free. I commend Tamil Nadu government. I commend the efforts of the government and various NGOs who have participated and make this happen. 2 decades ago, we were afraid of HIV, that is going to become a devastating problem. Although we have not eliminated it, we have managed a fair degree of damage control. Our nation today has 3 significant challenges. The first challenge is acute shortage of hospital beds. The second challenge is severe shortage of health human resources. And third most important, the newer and most threatening problem that we have is the new threat of non-communicable diseases. The required bed population ratio is ideally 1 bed for every 300 people. In some of our states, we have 1 bed for 1,000 people, and some other states have 1 bed for 1,300 people. To bring this equanimity of sufficient hospital beds, in the next decade, we have to invest 163,000 crores to meet this demand-supply gap. I believe we can do it. What we need is the government to proactively give us a stimulus to health so that we will be able to fill this huge demand-supply gap. The second is the health human resources. It's clearly accepted that we are severely shortage of doctors and more acute of our specialists. What we need is to double the doctors from 0.7 million to 1.5 million, to triple our nurses from 0.8 million to 2.5 million, and quadruple our paramedics from 2.5 million to 10 million. This certainly we should commend the Tamil Nadu M.G.R. Medical University to take these great steps in bringing up the graduates and the postgraduate, as well as the fellowship programs, to give as a great stimulus for the rest of the country to follow to do this. This will not only provide adequate health to do this. This will not only provide adequate health, human resources for health, but will be a great stimulus in providing employment for this large young populace that we have. The third is the most worrisome and the burgeoning problem of the rapidly growing non-communicable diseases. These non-communicable diseases will account for over 2/3 of the deaths in India. India already has the privilege of holding 3 gold medals. We are the diabetic capital of the world, we are the heart capital of the world, we are the cancer capital of the world. I hope you will all join with me in our efforts to say, let's throw these 3 gold medals in Bay of Bengal or into the Indian Ocean. You would be startled to see the predictions that India will have 350 million diabetics by 2020. But the statistics of 2011 reveal that we have already crossed 350 million diabetics in our country. What will be our position when it comes to 2020? So I believe that we need to, since diabetes spares no organ, we need to spare no efforts to fulfill this huge burden that we are facing. As a cardiologist, I'm also concerned of the severe cardiac problems that India is facing. It will all be fresh in your memory. 4 days ago, when the Singapore Airlines brought in an young 30-year-old technocrat, when he arrived on his birthday to get the wishes from his father. He saw his father from baggage claim area, but before the next few minutes he collapsed. The medical team rushed. Unfortunately, he could not save him. They could not save him. I was just 30-year-old. And it's not a one isolated case. Majority of the hospitals today are receiving heart patients at the 30s and 40s with an acute heart attack, and some of them are not even able to reach the hospitals. Some are fortunate, those who are able to reach, and the hospitals which have got the facilities are able to transform their lives by doing the primary angioplasties. What we need is to work on this great problem that is affecting the nation, the heart disease in our country. We need to tackle this big tragedy. What's appalling is that Indians, especially the younger Indians, are 4 to 5 times more prone for heart disease or heart attacks in the 30s and 40s compared to the Western population. But the good news amongst all this is that we can do something about it. And I believe young generation like you, all of you participating, will make that difference. The next is cancer. The word itself is a dreaded one. And every time we all know, as physicians and as patients, we experience that first word that you probably have cancer, you have cancer, is almost like a death sentence. We all know that the best institutions in the country and the best institutions in the world are able to have only 35% of patients who come to them with a 5-year survival rate. This is not because we don't have the best facilities. In India today, we have the latest technology, the great clinicians and the surgeons and the radiation oncologists and the chemotherapy. But unfortunately, most of the hospitals are seeing patients a bit late. But what we need is to propagate the word that cancer is curable provided it is diagnosed early. I think this is the second big theme that we need to take forward as in healthcare. So I believe primarily we should focus on bringing awareness of this national burden at an early detection. We have started a social program called the Billion Hearts Beating. The Billion Hearts Beating is to bring this awareness for people, saying that if you have these five major risk factors, and if you take care of those 5 risk factors, what are these 5 risk factors? Diabetes, hypertension, and the death sticks, the smoking, and more importantly, stress on over nothing, and lack of physical activities. If we do this and have some relaxation technique, what I've always said is we have exported the yoga and meditation. If we re-import this, I think this is the message that we're trying to give through Billion Hearts Beating. We have a few 100,000 people who have already taken this pledge. I'm looking for a day when we have at least 100 million young people who have taken the pledge, which will make a difference in their lives and in the life of their families and the national health. I look forward to other industries that they would say there is a huge scope and look at it as with a bright growth prospects. But we are coming from a noble profession and aim that I will endorse to bring all my powers for the united action to make together that we would like to make the nation as a healthy nation. Harnessing technology and transform healthcare delivery at the rural and semi-rural level is a great possibility, and I think this is what will really transform healthcare by bringing in a mix of resources